Welcome to Next Paradigm by Odin Labs, the podcast where we explore the future of health through the lens of systems biology, functional medicine, and cutting-edge science. I'm Zara.
And I'm Alex. If you're tired of symptom chasing and you want to understand what's really going on inside your body, you're in the right place. We go deep into the root causes, explore overlooked patterns, and give you tools that you can actually use.
Today's episode is a big one. We're talking about a hidden driver of chronic illness that most people, and even most doctors, aren't looking for: mold toxicity.
And before we start, I'd like to thank the sponsor of the show, Odin Labs. If you're struggling with chronic health issues and are having difficulty solving it on your own, consider learning more about their bioenergetic protocol. Book a free consultation at odinhealthlab.com. That's ODIN healthlab.com.
What if the brain fog, fatigue, or autoimmunity you've been chasing for years had nothing to do with your blood work and everything to do with your environment?
Exactly. Today we're diving into a root cause that almost no one is talking about. And it's one we see more and more in our practice. It's affecting energy, immunity, hormones, and mental clarity. I'm talking about mold toxicity. This episode is going to break down why it's so often missed, how it hides in plain sight, and what you can do about it.
It's such a big topic, and I know so many people are going to recognize themselves in what we're about to describe.
Let's start with the bigger picture. We're seeing a wave of people, especially women between their late 20s and early 50s, who are dealing with a lot of brain fog, fatigue, mood swings, unexplained joint pain, hormonal crashes, food sensitivities, even autoimmune flare-ups. And yet they go to the doctor and they pretty much hear the same thing. Your labs are normal. Nothing is wrong.
Exactly. And that phrase can be so invalidating when you know something is wrong.
Yeah. These are what we call mystery illnesses. People are exhausted, inflamed, anxious, and often dismissed. The system really isn't built for root cause medicine. It's built for emergencies and symptom management. So if your symptoms don't fit neatly into a diagnostic code, the system really doesn't have much to offer you and often lets you down.
And even if someone does want to dig deeper, going the functional medicine route can be really expensive. Most of it isn't covered by insurance.
Yeah, that's right. It's really sad. Testing, consultations, protocols, they add up pretty fast. So we end up with a large group of people who are both sick and out of reach of care they really need. It's a painful place to be. We had people do whatever it takes to get help. One of our patients actually flew in from Argentina to see us. She had chronic Lyme disease and mold toxicity, and no one back home was listening. She was kind of in the same situation. So this is not US-based or Canada-based. It's really kind of a problem with medicine as a whole.
That's heartbreaking. So what do you think is contributing to this massive rise in these unexplained chronic conditions?
That's a really great question. I think it's not just one thing. These conditions are almost always multifactorial. It's stacking effect that kind of overwhelms your body's ability to regulate and heal.
Like a bucket that slowly fills up until it spills over.
Yeah, exactly. Here are a few of the big contributors that kind of like I see all the time. So environmental toxins, this is a big one, like for example mold, but also heavy metals, glyphosate, plastics, pesticides, things that are around us that we're exposed to. Infections and pathogens, Lyme disease is one of them, Epstein-Barr virus, parasites, chronic stress and trauma, including early childhood trauma, emotional stress, and nervous system dysregulation in general. Lifestyle factors, poor sleep, artificial light, sedentary habits, processed food, and genetic predispositions. That's a big one that people don't think about, right? Especially around methylation and detox pathways.
So it's like a perfect storm building silently in the background.
Yeah, exactly. Which brings us to today's focus. We're going to zoom in on one of the biggest hidden culprits, right? Mold is, like I said, one of the most overlooked parts of this mystery illness bucket.
Because if you've been chasing your health for years with no clear answers, this might be the missing piece no one's talked to you about yet. All right, let's get into the core of today's episode. What exactly is mold toxicity?
Okay, so mold toxicity isn't just about having visible mold on your walls. Mold is a type of biotoxin and, more importantly, produces these chemical compounds called mycotoxins. These are the real disruptors. Mycotoxins can hijack your brain chemistry, dysregulate your immune system, throw off your hormones, and basically confuse your entire biology.
And you can be exposed without even knowing, right?
Absolutely. Mold can grow behind drywall, under carpets, in air ducts, bathrooms, old basements. You don't need to see or smell it at all, and it can be affecting your health. It often hides in buildings with past water damage, bad ventilation systems, which is many buildings, unfortunately, in North America.
So if mold is everywhere, how come some people are fine and others fall apart?
Here we go. You hit the nail on the head. That's the million-dollar question. Mold itself isn't always the problem. It's how your body responds to mold that matters. For some people, for example, exposure is mild and asymptomatic, really. They don't feel anything. For others, it can be absolutely devastating. And that has to do a lot with genetics and detox capacity. So this is where we bring in the concept of bioindividuality, right? So two people can be exposed to exactly same moldy environment, same house, same room, and one gets extremely sick while the other feels totally fine. And between that happens a lot between spouses, right? When one of them is sick and the other one thinks that the person is hypochondriac.
That's so wild. Why is that?
Well, the first factor is HLA-DR genetic variants, right? Basically, all that means is that these genes that influence how your immune system can recognize and tag biotoxins, like molds, for removal. And if you have one of these susceptible variants, right, that particular genetic variant doesn't work quite well, um, what's going to happen is your immune system gets stuck in kind of a loop where it can't properly clear the mold from your body. The inflammatory response from your immune system just keeps going and going and going.
So the immune system is kind of stuck in overdrive.
Yeah, exactly. And that chronic immune activation can lead to things like brain fog, fatigue, anxiety, and even autoimmune systems. And the second piece is detox genetics, right? So other genes like MTHFR, COMT, MTR, MTRR, all of these impact how efficiently your body can break down and eliminate toxins. If your pathways are sluggish, mold toxins can hang around longer and cause more damage.
So it's not just about exposure, it's about how your body can handle exposure.
You got it. Yes, exactly. That's why we sometimes refer to a sensitive person in a household as basically like early warning system, because there is a real danger there and they're just reacting faster. And just because you are not reacting, it doesn't mean the exposure is safe long term, right? So it's actually a really good thing that somebody is sensitive.
Okay, so we've talked about how mold affects people differently, but what does it actually do to the body once it's inside?
Well, mold exposure really disrupts immune balance. So initially, it creates chronic low-grade inflammation, right? We've heard all about that, right? So it's definitely bad for you over a long period of time. And this constant immune activation, right? So inflammatory response is an immune reaction, right? So your immune system literally says something is wrong. We need to sound the alarm in order to remove that danger, right? But that constant immune activation can spiral into something that's more serious, like autoimmunity. It's when basically your immune system gets confused, and instead of just targeting, the toxins or pathogens like mold toxin, it can start cross-reacting with your own tissue. It starts attacking your own body.
So mold could actually trigger autoimmunity? That's a big deal.
Yeah, exactly. And in a lot of patients, mold toxicity isn't the only problem. It's basically the last straw. So if you think about it, the bucket was already full from, other things like stress, infections, or toxic exposure in other forms, right? And then mold just tipped them into a full-blown autoimmune response, right? That's why, things like Crohn's disease happen, or lupus, all of these autoimmune reactions.
Are there specific tests you use to see if someone's immune system has been hijacked like this?
Yeah, for sure. You can do like blood panels, right? You can run them like they would in conventional medicine. And they would look for things like uh, TGF beta 1. It's a marker of immune system dysregulation and tissue remodeling. Um, uh, C4A is another immune system uh, complement protein, often elevated in biotoxin illnesses, so mold exposure. Uh, MSH, right? That's another one. It's important for regulating inflammation, sleep, and gut health in general. VEGF, it gets disrupted in chronic mold illnesses, affecting blood flow and healing. These deeper markers help us understand if your immune system is stuck in a fight that it can't win, right? In that loop that we talked about just now.
Let's say someone's listening and thinking, this sounds like me. How do they actually find out if mold is the problem?
Well, first, you kind of need to go over the history, right? You need to deep dive in someone's background to basically look for signs, right? So early childhood trauma, infections, and especially environmental exposures. Like, let's say they lived in Florida and it's a known place for mold, right? So mold illness rarely happens in isolation. It's always layers of things.
And after that?
Then we need to kind of do a little bit more testing. And there's actually tools that are available now that are more related. They're called functional tests, right? So they're more related to what we're trying to find out, right? So, for example, a company called Vibrant has a Vibrant Total Tox panel, right? And it's a comprehensive scan for mycotoxins, glyphosate, plastics, heavy metals, right? So definitely helpful, right? They have another one, Vibrant Mold panel, specifically focuses on mold, and it shows specific species of mold that you've been exposed to, so you can address that. And there's also, DNA tests that are very helpful, right? They will tell you which genes are not going to work, that you have impairment with. And you can also do things like, urine test with provocation, right? So this is actually a really cool concept. So you basically do a sauna or lymphatic massage to provoke the release of stored toxins.
That concept is so cool. I just learned about it recently. Using sauna or lymph work to coax out toxins and hidden pathogens from tissues, and then testing right after. It gives you a more honest picture of what's really going on, right?
Yeah, exactly. Without provocation, you might miss what's buried deep inside the body, because that's what happens. These pathogens and toxins are stored in our tissues, and they often don't show up on the blood tests, right? So that's why when you go to the doctor, they go, everything is normal, but it's not, right? So it's one of the most effective ways to get clarity, basically, especially when someone's symptoms are really bad, and nothing shows up on standard tests.
So what do you do if your regular labs look fine, but you still feel awful?
Well, that's where you need to go to the functional medicine side, right? Normal isn't really a thing in functional medicine, because, if your symptoms are not normal, you're not normal, right? You're sick. So basically they start digging until there's a clear understanding of kind of what's going on inside your body, right? And now a quick break to thank the sponsor of the show, Odin Labs. If you're struggling with chronic illness and chronic health issues and are having difficulty solving it on your own, and doctors could not help you, consider learning more about the bioenergetic protocol. Book a free consultation at odinhealthlab.com. That's ODIN healthlab.com.
Okay, so let's say someone's just found out they've been dealing with mold toxicity. Their first instinct is probably to start taking all the binders and antifungals, right?
Yeah, that's what people usually think and do, but to be honest, it's a huge mistake. The real detox doesn't start with killing the mold and getting rid of it and getting rid of the toxins, right? Um, it's kind of counterintuitive because you really need to start with regulation in calming your body down. It's a very interesting concept because if your nervous system is in fight or flight and your drainage pathways are not working quite properly, right? They're clogged. Any detox protocol that you're doing will backfire. Think about it. So let's do a little exercise. Try to make a really, really tight fist and hold it. Would you be able to go to the bathroom and eliminate? Probably not. So that's why the first thing we need to do is to relax, right? Like, in order for detox to work, we need to be in a relaxed state. That's exactly how, the body works during a detox, right? It needs to relax first.
This is so different from what we're used to hearing. Why does detox start here?
Well, like I said, because the body can't eliminate toxins if it doesn't feel safe. So the step one is always calming the nervous system. And, we've talked about it many times on this podcast, breath work, uh, like simple things like sunrise and natural light exposure, screen hygiene at night, like don't look at the screens, PEMF devices. They basically help your nervous system to relax. Hard math for HRV regulation, lymphatic massage. All of these can make a huge difference. And if if you are super stressed out about what's going on in your body, what are the chances that your body will heal well? Probably not a lot, right? Because you're piling stress upon already stressed out system. So in order for healing systems to start working, you need to first feel safe. That's why we need to do some work before you start doing the detox, right? Um, and that's kind of what you're looking to create in a functional kind of treatment protocol.
And what about supplements for this phase?
Well, absolutely. So you can use supplements if you're not able to use things that are kind of like outside your body, like, well, not outside your body, like things like, sun exposure and other things to basically train your body to become. So here are some examples of things that work well. So liposomal GABA, it's excellent, and L-theanine for calming brain and basically put you in this kind of like meditative state and reduce some stress. Vitamin C, stinging nettle, uh, DAO enzyme to reduce histamine and inflammation. Non-methylated B vitamins, actually. So this is an interesting thing because the recommendation is always to use methylated B vitamins, but in people dealing with mold toxicity and chronic inflammation, and perhaps poor detox capacity, methylated B vitamins can be too stimulating, right? So you kind of need to start with non-methylated versions of it first. And antioxidants like quercetin or SAM-E for mood and detox regulation. And homeopathics, right? Homeopathics is another thing that can definitely help. We can target like liver, kidneys, and lymphatic in an energetic way.
Okay, so once the nervous system is stable, what about drainage?
Absolutely. So drainage at the end of the day, it's the final step. You need to eliminate it. It's the exit door for all of these toxins that we're talking about. So you have to get it open first, and because if toxins have nowhere to go, they will simply recirculate, right? They will basically get reabsorbed by your body. So it's kind of counter to what you're trying to do. So you need to focus on basically things that support your liver, bowel support, lymphatic support, right? So for liver, you can do things like NAC, milk sithal, um, uh, Tadka is another one. All of that will increase bile flow, right? For bowel support, doing things like castor oil packs, right? External, that works well. Magnesium, enemas if people are constipated, right? For lymphatic support, there's lots of compression suits, right? So that increases the lymphatic flow, and sweating in an infrared heat. Uh, it absolutely promotes deep drainage and parasympathetic balance. And this is crucial. You need to have a daily bowel movement before starting binders, right? Because if your body isn't able to eliminate properly, the toxin will simply get reabsorbed, and your symptoms just will get worse.
All right, so let's say someone's gone through the preparation phase. They've calmed their nervous system, they're supporting their drainage pathways. What's next?
Okay, well, now we need to start talking about the detox, right? The actual detoxification. Since we're focusing specifically on mold, here are important things to keep in mind. So you need to remediate mold from your body and environment, but you need to do it not on your own. This is because you really need to work with a professional, because this type of elimination can be quite dangerous, right? It's very easy to go too far and overwhelm your system. So you need to have supervision in order to prevent too much toxicity being eliminated at the same time.
Right, so how do you approach mold detox when the body is ready?
Well, antifungals and binders, essentially. So you need to kind of start with gentle antifungal and binder support, and you kind of need to lay them strategically, right? So some of the things you can use for antifungal support, right? Like if we're talking about antifungal specifically, so oregano oil works quite well. Uh, Caprylic acid, garlic extract, all of these have antifungal properties. But there's also formulas, right? So uh, biocidin it's a liposomal broad spectrum formula of various things put together. Kind of, it's like all in one formula, and it's quite effective when mold has colonized mucosal surfaces, right? And again, remember, you need to do all of this stuff under supervision, right? Because these antifungals are very potent, and they're dose dependent. So you need to figure out what's the right dose for your body, and you need to also kind of monitor what's going on in your body, right? So in terms of like liver and detox pathway support, milk sithal works quite well. NAC, B vitamins to help the liver process and eliminate toxins effectively. If we're talking about kind of like antioxidant and immune support in general, right? So vitamin C is excellent. Vitamin E, zinc, selenium, to help neutralize oxidative stress from mycotoxins. Um, Beta glucans and vitamin D3 to modulate immune function. So vitamin D is like the most common one, right? So we want the levels to be kind of between 50 and 80, right? So kind of that's why you need to monitor it, because you kind of need to use a professional in order to do these tests for monitoring, right? And then binders, that's super, super important. They're essential, but timing is everything, right? So binders can actually do the opposite, right? They can bind to things that you want as well as things that you don't want. So you always want to take them on an empty stomach and at least 2 hours away from medications or meals, so they don't block nutrient absorption, right? And there are prescription binders and natural options, right? So prescription binders can be cholestyramine and Welchol. They're quite effective, especially for more severe cases, right? In terms of natural options, there is things like, activated charcoal. So activated charcoal is great, but it's gut specific. It's not systemic, right? So there's other things that work on the systemic level, right? So zeolite, bentonite chlate, modified citrus pectin, that one is gentle and systemic, and chlorella is also, it's an example of food that's also a binder, right?
So what happens if someone skips the prep phase and just starts taking binders or antifungals?
Well, that's where you get into something that's called Herxheimer's reactions. It's basically where your body releases toxins faster than it can eliminate them, and people end up with a lot of very unpleasant symptoms. You can have rashes, headaches, anxiety, fatigue, panic attacks. It's basically detox that's gone wrong. It's just it's not that it went wrong, but your system wasn't ready fast enough.
So detox done right feels relieving, not punishing.
Yes, exactly. Done properly, detox is it's a very powerful and transformative tool in functional kind of medical toolkit, right? But it has to be done in the right order.
So once someone gets through the detox phases, how do they stay healthy long term?
Well, this is definitely, the real art of healing. Long-term recovery isn't about, being on 20 supplements forever. It's about creating a new normal that keeps your body resilient.
What does that actually look like?
Well, first, uh, again, let's not go crazy with supplements, because, you know, we need to kind of get the basics covered, but, endless pill popping isn't the idea. Things like circadian rhythm anchoring, right? So what does that mean? Essentially, it's simple things that you should be doing, but you're not doing. So, for example, morning sun exposure, right? Go out in the morning and look at the sun for 10 minutes. Regular sleep cycles, right? So a lot of times people sleep in a very irregular way. They, wake up at one time, go to sleep at another time. It's all upside down. So the more regular you can make it, you go to sleep at 10 o'clock every night, wake up at whenever it is, 7 o'clock or 8 o'clock or 6 o'clock every morning, right? Very, very important. And that's what the anchoring comes in, right? Things like grounding outdoors, right? We also want to keep working on keeping your environment as clean as possible. I realize that, it's not always possible, but you can do your best, right? So doing things like getting high quality air and water filters, right? Minimizing exposures to plastic, pesticides, and toxins. And, sometimes people need extra support, right? So there's advanced therapies, right? So ozone therapy is really good. It's where they literally draw your blood and then they expose it to ozone and then put it back in, right? So it's a very, very effective way to detoxify your body. There is also red light therapy, right? So, various forms of it. There's many different ways of doing it. Hyperbaric oxygen chambers are excellent. And even things like, Tai Chi or Qigong, right? Like it's those Asian practices, they keep the nervous system nice and balanced. and they're super helpful.
How do people know when they're ready to stop, when they're actually better?
Well, that's a really good question. Essentially, what you need to look for is pattern shifts. So for example, if you're very, very tired and all of a sudden your energy starts stabilizing, right? And maybe your mood lifts, sleep deepens, food sensitivities disappear. It's not about feeling less sick. It's all about finally feeling resilient again, right? And you kind of want to monitor that and make sure that the healing has taken root. And at that point, it's your decision, right? Like you might want to stop. The mold might be the hidden root behind what feels like unsolvable conditions, right? If you've been struggling with brain fog, exhaustion, anxiety, autoimmune symptoms, and nobody can explain really, mold could be on your radar. You should consider that as a potential thing that kind of the root cause of what's going on with you.
And the hard truth is, conventional medicine just isn't equipped to deal with this yet. It's a systemic gap, but it doesn't mean healing isn't possible.
Exactly. As we discussed, healing is absolutely possible, but it does require, doing the treatments in the right order, really considering your individuality, having patience to rebuild properly, right? Because it doesn't happen instantly. And when you're sick, you want an instant solution, unfortunately, right? So yeah, I mean, if you're looking for deeper answers or need help getting tested and starting your recovery journey, consider visiting the sponsor of the show, Odin Labs. Um, if you're having difficulty solving chronic health issues, and specifically, you've tried different things like going to the doctors and kind of nothing is helping, maybe learning more about bioenergetic protocol is a good option for you. So book a free consultation at odinhealthlabs.com. That's ODIN healthlab.com. And see if that could be a viable option for your healing. Thank you for listening. This was a really important topic. I find that this discussion was very informative, and I hope you thought that as well. And we'll talk to you next time.
Thank you so much for spending this time with us today. If today's episode resonated with you, or if you know someone who's been struggling with unexplained symptoms, please share this with them. You never know who might need to hear it. Until next time, stay curious, stay resilient, and keep moving toward your next paradigm of health. We'll see you soon.